Hello, lovely. How are you? Good. I'm Nurse Nicola. I am one of the specialist nurses here at How to Stop. I'm guessing you're here because you would like some help in quitting smoking. That's alright then, you are in the right place. So, if I could just take your full name. And your date of birth. Great. First line of your address. And your postcode. Great, and finally a contact number. Excellent. Great. So, get yourself all comfortable, alright? It's nothing too formal here, okay? I'm here to help you and start this journey with you, alright? But I just want to say, well done. This is the first step and it's taken so much for you to come here today. So you should be really proud of yourself because I am definitely proud of you, alright? Okay, so here is a safe space where you can be open and honest with me as much as possible. Okay, so my aim today is to understand how you are struggling and what your goals are and things like that, and how I can be of help to you and the things that we have to offer. All right, okay, so I'm going to be asking you a series of questions and I'm going to be popping them onto the system. Alright, so first thing I would like to know is how long have you been smoking for? Okay, so quite some time. Alright, how many do you smoke on average a day? Okay. Do you find that you smoke more if you go out? So if you're on a night out or something like that with friends, family? Yeah, it's a bit of a social smoker. Yeah, okay, that's a lot of people are like that, so alright. And at what times do you feel like you need a cigarette? Is it any particular time? Okay, so you'd say when you get up, go to bed, and okay. What about during work hours and things like that? Okay. So good. Why did you start smoking? Can you remember? Think back all that time. What was the reason that you started to smoke? Yeah, okay, so peer pressure. Alright, so peer pressure is a huge factor in a lot of people's addictions. Yeah, definitely. So you were quite young and you were pushed into smoking, trying a cigarette, should I say, and they were convincing you to. When you said no, they pushed more. Yeah, so exactly, that is typical peer pressure, which is not acceptable, and you are your own person and you're entitled to do what you want to do, not what somebody else is trying to get you to do. Alright, but you went ahead with it and you tried it. Did you like it? Not particularly. Yeah, was it the taste, the smell, or everything? Yes, you had a little bit of a nicotine rush. So dizzy and weird and things like that. Yeah. And then did it become a regular thing that you fancied trying it, or was it more peer pressure? How was it for you? Okay. Right. Okay, so I can see where that has developed from. Yeah, okay. Uh-huh. Well, that's very interesting. Yeah. And then you be kind of wanted to have more of it, and then was it more of a habit, or was it a need? Was it a want? Was it because just did for the hell of it? What was it for you? Yeah. Well, that makes sense. So when the stress kicked in or some problems were arising, you would smoke and then you ended up getting hooked on it. Okay, that makes sense. Yeah, yeah. And then you started smoking more and okay. Did you find that that actually made you happy? Did it help you? Like, did it solve those feelings? Okay, so you think it did. Right, very interesting. Yeah. Yeah, obviously, because you carried on. Yeah. Okay, let me just jot that down. Great. So all that makes sense to me. All right, so when you started smoking, how it come about, why you continued, how it made you feel. So think about now when you are further along on your smoking, do you find that you were enjoying it as time went by, or was it okay, so you sort of believed that it was helping and yeah, and it was making you feel better, but obviously, as you said previously, it wasn't really having that effect. But now, what do you think it is about it? And what was it back then? Was it a habit of having something in your hand? Was it a form of comfort from anxiety or something like that? What do you think? Yeah, that makes sense. Oh, okay. Yeah. That does make sense to me. I mean, if you got low mood and you're feeling quite down and depressed, and that makes sense, and it is a sense of a relief, but a lot of that is psychological and it's addictive, so it's going to give you these feelings that you need it and that you want it. Yes, does that make sense to you? Okay, good. Brilliant. So, how does it make you feel? Tell me, how does smoking make you feel right now? Just over the years, just explain to me. If you were going to light up a cigarette now, took a drag, tell me how you feel physically and mentally. Well, that's interesting. Yeah, I get that. Well, yeah, especially if you are experiencing a cough and sore throats and things like that, it's definitely, seems something related to the smoking, but you'd have to be examined before we can be 100% sure on that, but you know, it's quite common that some people can develop a cough, sore throats and things like that. Yeah, I mean, I had a patient who kept getting sore throats and throat kept cutting out and all sorts of things like that, and they found that she actually had a buildup of tar here, and it was affecting her larynx and trachea, and the thinning of it and things like that. It was quite complex. Yeah, so you know, that is a possibility. Things like that can happen. Yeah, I mean, I don't want to scare you or anything like that, because you know, I'm just keeping it real and down to the line here. You know, I'm going to offer you all the information, things that you need to, you know. All right. Okay. Yeah. So you wouldn't say it's making you feel great as such, then? Yeah. Okay. It's quite funny, really, because some of my patients, they said that as they got further along, as they've been smoking longer, they started to enjoy it less, and it was just like, oh, why am I having this for? But they still couldn't stop. So it's quite interesting. Yeah, would you say? Yeah, I understand. Yeah, it's really interesting, isn't it? Okay. Okay, so why? Tell me why you want to stop smoking. Is it something that you're being forced to do? Because we come back to that peer pressure thing. Even though this is kind of good pressure, it's still not good to be wrapped up in that kind of situation, if that makes sense. Okay, so tell me, why do you want to stop? Yeah. Okay, that makes sense. That's really good. In health, family, future, yeah, money. Save a lot of money. Yeah, and you know, it'll smell fresher, teeth will get better, and all sorts of different things like that. Yeah, you've got good reasons there. Which one stands out to you the most? Yeah, it's a really good positive note. Hold on to that. Okay, so do you vape at all? Okay, so you just do cigarettes. Have you ever tried vaping? Wasn't keen. I mean, some people say, you know, you're better off to go onto vaping because it's not as bad for you. But the thing is, there's a lot of chemicals in the vapes, and they actually aren't very good for you either. It's just kind of a vicious circle. You're sort of moving on to one thing and getting rid of another thing, and they're all just as bad as one another. Yeah, I mean, you can do your own research on things, and it's totally down to you what you want to do. Some people would rather vape as they feel it's safer, and you know, you can get different flavors, and they say you don't really smell and all those things, but they aren't very good for you either, and they are addictive. And then other people are saying, well, they're cheaper than cigarettes, and vice versa. You know what I mean? It's round and round. But personally, I would say if you wanted to stop smoking, not to go onto the vape, I would say use other methods to get off smoking, so you don't go back or go into something just as bad, or technically it could be worse. Yeah, okay, that makes sense to you. Good. Do you drink alcohol at all? Okay, and how much? Okay. Have you ever had any addictions to alcohol? Okay. Do you do any recreational drugs at all? And have you ever been addicted to anything? Okay. Great. So do you admit that you have an addiction? Great, brilliant, fantastic. It makes me so proud to hear you say that. All right, I know the first step is coming here saying, you know, I need help, but to actually acknowledge that you have an addiction is fantastic, okay? It's really brave for you to do so, and it's a really good positive start. All right, okay, that's good. Fantastic. That's great. Do you have any allergies at all? Okay. Are you on any medication? Okay. Okay. When's the last time you had a medication review? Okay, that's fine. How's your sleep? Do you get a good night's sleep? Do you ever wake up and need a cigarette, or do you just go for one anyway, or? Okay. Perfect, that's good. How would you say your stress levels are, just on an average day to day? Anything make that worse or better? Okay. So do you feel like you could put that into practice rather than having a cigarette? Okay. Fantastic. How would you say your mental health is? Okay, so that's good. Have you ever had any issues? Okay. How did you deal with that? Okay. Do you work? What do you do? Okay, and how do you find that? Well, that's good. And what's your smoking like during the day? Okay, well, that's quite good, yeah. And are you studying or anything like that? Okay. Do you have a partner, kids, or anything like that? Okay. Do any of your family members smoke or? Okay. And who are those? Alright, what about your friends? Yeah. Okay, so that's quite good though, you've got a mix. So some don't smoke anyway, some newly quit, others don't want to, and yeah. Okay, well that's really positive. That's really good. Great. Perfect. What are your goals? Yeah, stop smoking. Okay. Do you think you can go all in and stop immediately, or do you think you need to cut down and work your way through like that? Yeah. Personally, I would say not cut down, because you'll cut down and then you'll just stay at that level and a bit more, or then you might just easily go back up again. Okay, I would say personally, I don't really like using the term cold turkey, because I don't want you to plunge right into it and have nothing. That's where I can give you some things to help you and do it that way, rather than pure cold turkey and have nothing, because that's going to be, you know, detrimental to everything. And if you cut down like that, I don't think it's really going to be very beneficial. All right, but don't worry, we can talk about that. Okay, so let me just perfect. Do you exercise at all? Okay. And how's your diet? Okay. Perfect. Right, so I'm just going to carry out some checks. Okay. Start with your peak flow. Have you done one of these before? Okay. You're right. Good. Right. So this is a peak flow meter. What I need you to do is take a nice breath in, and you're going to push out as much as you can, just with your lungs. Okay, I want to see how much oxygen we have in your lungs. All right, so we go, hold it, and then let go. All right, so let's have a practice run. All right, so there we go. When you are ready, that's it. Good, let me have a look. Okay, no. Try again. Okay. Good. Let's have a look. That's better. Give it another go for me. Nice, big in, and breathe out as much as you can. Fantastic, thank you. It is a little on the low side, but you do smoke, so it's quite expected. But are you asthmatic at all? Right, okay. Do you suffer with hay fever or anything? Is anyone in your family asthmatic? Alright, that's fine, thank you. Can I just listen to your pulse, please? Thank you. Okay, okay. A little bit on the high side. Feeling anxious at all, or okay? Right, this little thing is going to measure your pulse and your oxygen levels. All right, so if I can get you to pop your index finger in there for me. Thank you. Just keep nice and still for me. Okay, it's not too bad. Okay, thank you. Being a smoker, it's quite expected to, you know, not to be as good as somebody who doesn't smoke. So let me just pop that down. Pulse is as expected before, so okay. Okay, my love, I'm going to check your blood pressure. Sit nice and still for me. A bit tight. Blood pressure is in the normal range, which is good. I'm going to have a listen to your chest. You just pull your top down slightly. Nice normal breathing for me. a nice deep breath in for me. Hold. Release. Same again. Good. Deep breath in. Hold. Release. And one more time. Good. Nice deep breath in for me. Hold. Release. In. Hold. Release. Good. In. Hold. Release. Perfect, thank you. Okay, just going to listen to your heart. Can I just have your wrist? Thank you. Just check your pulse. Perfect. It's brilliant, you can pop your top down. So heart sounds strong and pumping as it should. Alright, I'm not concerned with that, so we don't need to send you for any ECGs or anything like that. Okay. Unless you have any concerns with your heart yourself. Okay, that's fine. Pulse matches and chest, so no crackling, sounds clear, no wheezing. Okay, so that's fine. Right, if I could just get you to pop on the scales for me, just over there. Thank you. Do you know what height you are? Okay, thanks. Okay, keep nice and still for me. That's it, nice and still. That's perfect. Wonderful. Okay, you can pop back. Excellent. Right, I'm going to have a little look in your mouth. Okay. Okay. If you can open wide for me. Thank you. Tilt your head slightly, thank you. Tongue's quite dry, a bit bumpy at the back. Do you always have that, or is it something new? Okay, roll your tongue up for me. Okay, pop it back down. Look at your cheeks. Right, I'm just going to pop in my depressor. Okay, thank you. Down we go, and in. Tilt slightly, thank you. It's quite red and inflamed at the back. Have you noticed that before? Okay, say R for me. Good. I'm going to push right down, okay? Can you just cough? Alright. Thank you. I'm just going to feel, alright? So open for me. Thank you. It's quite bumpy. I'm going to put my hands a little bit further in. Alright, I'm sorry. I know it's not very pleasant, but you're doing really well. Okay, wonderful. I'll just bring it to the edge of your tongue. Do you ever get any ulcers? Whereabouts? Okay, I'm just going to feel and look at the inside of the cheeks. Okay, so I can feel some bumps there. Any pain? Okay. Do you ever have any bleeding from your mouth at all? Can we really brush your teeth? Okay, there's a little bump there as well. Okay, right, I'm just going to pull down the lip. Yeah, I've got very red gums, receding as well, quite discoloured, but not, you know, a huge amount. I mean, I'm not a dentist, but, you know, I feel a few bumps on there as well. Alright, now just pull up. The odd bump there. Any pain? Top teeth aren't too bad. Okay, that's fine. And take your temperature. Okay, it's perfectly fine. I'm wondering if you have the start of gum disease. Alright, that's why I recommend that you go and see a dentist. Alright, yeah, I think it's best to get checked. And they can prescribe you things, you see. And temperature. Okay. I'm just going to have a little look in your eyes, alright? Look at my nose. A little bit bloodshot. Okay. You're up to date with your eye examinations. Okay, keep looking at my nose. Here for me. Here. Perfect. Look here for me. And, okay, my love, thank you very much. Look here. There. Good. Here. Perfect. Just look up from with your eyes. Back at me. Good. Fine, they look fine. A little bit bloodshot, but you could be tired or something like that. All right. Yeah. Okay. Just make sure you are drinking enough fluid, and make sure you do try and get enough sleep. All right. Okay. Let's put it there. Right, so I'm just going to have a look at your skin. Okay, then I'm going to check your sinuses, glands, and your ears. All right. Okay. Do you use any skincare at all? Got some broken capillaries here at the edge of your nose. Okay, there, and then kind of go up side a little bit. Skin's quite dry. All right. Got some dry patches. A little bit of one here. A little bit there. And it's just a tad on your chin. All right. You had that a while, or? Okay. So overall, looking at your skin, I mean, I'd say it's in pretty good condition. You do look after your skin. You do have the broken capillaries here down by the nose, and obviously the dry patches, and overall your skin does feel quite dry and dehydrated, which is typical for smokers. All right. Okay. Now let me just check those sinuses. All right. Let me know if you feel any pain. sniff for me. Okay. Okay, can't feel any blockages or anything like that. You're not experiencing any pain, so it's all good. Just going to bring down check down your neck and under your chin. Any pain? None at all? Good. Slightly swollen glands there. Does it feel like you have a sore throat at all? Okay. All here feels fine there, just quite swollen here, there, just check. Yep, so that's definitely fine, all the glands there are fine. That feels alright. A bit tender possibly there. Okay, so I'm just going to go across the upper chest. Any pain? Okay. Perfect. All feels fine. I will be writing this all on the system later, alright, so it will be all on your file, then this will all be shredded, alright. Wonderful. So, I'm happy with that. Can I just check your nails, please? The other side. Okay, that's fine, thank you. You're all up to date with your bloods. When was the last time you had bloods? Okay. Probably suggest you seeing the phlebotomist then. Just getting all your bloods done. Yeah, I will have to have a look on the system first and see what's done and what's not done and what I would like to do. Otherwise I would have taught them myself today. Alright, okay. Right then. Okay, so I'm just going to go through a few things with you. So the first thing I would like to say is think positive. All right, you want to make positive changes and you want to be positive about your future goals. All right, and you don't want to turn things into a negative. You always want to try and make sure that you're positive about things, and you know, if we have a bit of a blip, it's okay. Don't punish ourselves, you know, turn it around and make it into a positive, like, okay, I've done this, but I've learned I can do this better, or such and such, if you know what I mean. Yeah, so think positive is a very, very important one. Okay, I want you to think about your last attempt to quit, all right? And I don't want you to feel bad about it, that you failed, if you like. I want you to actually learn from it instead, all right? So learn the things that you did wrong, you know, what could you have done better? How would you do better next time? What can you stop to stop that happening? What can I do to stop that happening, etc.? Do you get my point? Yeah, so look back at it, reflect on it, and, you know, have it as a learning curve, and, you know, just feel like you want to beat that next time. I'm going to do better than that. You know what I mean? So make it into more of a positive kind of challenge for yourself. All right. So you're going to make a plan. All right. So having a plan is a very good point. It's something to work towards. It's a goal, and it gives you a bit of routine and structure, which is always important. Okay. So this is for you. I want you to make a plan and a promise, but for you only. So I want you to promise yourself that you're going to do such and such. Okay, so that is for you. It's not for anybody else. You don't need to tell me, but you can if you like. It's totally up to you. That's for you to lock away and keep to yourself. All right. And I want you to think of a date and set a date when you're going to start the journey. So if you are going to walk out of here today and that's it, or do we want to say start in a week's time? Do we want to start tomorrow? Think of a starting date that we want to start with. Now, I don't suggest that you start right now, okay? I would definitely say go away and think of a date. So I would say tomorrow, but I'm going to prescribe you some things and you might not be able to get it in time. If you get all the prescription today, then I would say, why not try it tomorrow? You know, start tomorrow. Or say a time tomorrow or something like that, all right? But don't pressure yourself. If that's too soon, think, okay, well, let's say start in 2 days or something like that. All right, so let me just pop down. So, got a plan. So you think you're going to start it tomorrow. Okay, I'm just popping this down. It doesn't mean you have to stick to it, all right? But when you finally decided the date, you have to stick to it then, all right? Okay, so at the moment we're saying potentially tomorrow, okay? And then you're going to stick to that and then try. Okay, so tomorrow, all being well, if you can get your things from the chemist, and that will be good. So your promise is to, okay, good. And what's your plan? And this can change, you know, you can write it down. I'm going to give you a nice little booklet soon anyway, and you can fill it out, all right? So your plans, your goals and achievements, targets and things, or things where you haven't done so well and things like that. So I'll give you that before you go. Okay. Okay, yeah. That's good. Excellent. I like that. Good. Okay, also going on when I say you want to pick a date, try not to drag it on too long. So if you say, oh, well, I'll do it tomorrow, do it the next day, you're putting it off, okay? So I'm being lenient with you. So we'll leave today, get your things from the chemist, and we should start the first thing tomorrow morning, or if really, you know, at the end of the day. But I wouldn't really suggest leaving it any longer, because you're going to put it off and you're not going to do it. And then this, you know, it's kind of been a waste. You know what I mean? I mean, if you're raring to go and you're feeling it right now and you think, yes, I'm going to give this a go, do it. Definitely start tomorrow. Do you feel like you can give that a go for me? Fantastic. You've got this. Honestly. Brilliant. So we're going to give it a go tomorrow. Don't drag it out. Yeah? Done. So what I want you to do, though, is be realistic. You've got to be realistic about your goals. So you can't say, right, in a week's time, I'm not going to have any cravings. I don't need any more cigarettes. I'm done. I'm perfectly fine. I'm cured. That's just not realistic, is it? You know, so you're going to have, okay, well, hopefully in 3 months' time, I still won't need any cigarettes. I'm done, or I'm off the gum or patches or whatever. All right? Yeah? Or you might have a blip and you start again or something like that, okay? But be realistic with your goals and achievements, okay? So it's a journey, okay? We're not running a sprint or anything like that. It is a journey, all right? So we've got to get somewhere, yeah? It takes time. Like marathons, they take time, all right? Good. So be realistic with your goals, with your, you know, your wants and needs and things like that, okay? But you want to give it your all. You have to put all your effort in. You need that willpower, and you need the strength to push through them hard times, okay? But if you've been through some things in life and they've been very difficult, if you've got through them, you can get through this, all right? Because this is a little minor compared to some things, okay? Yeah, so we're going to start tomorrow. That's good. And we're going to take it day by day. Okay, we're going to be realistic. Don't drag it at the start out. Okay, are you happy with all that? Good. That is all I kind of want to write myself. That is just a brief plan with me. When I give you a book, your homework, if you like, is to make your own kind of, you know, plan and things like that out. Promises to you. All right. Okay, so that's going to be in your own time to do that. I mean, next time I see you, I can always read through them if that's something you would like me to do. But, you know, don't feel like you have to share. Okay. So, consider a diet change, right? So some people find that if they stop smoking, they put on weight and that puts them off. Now, the actual reason for that is usually because people just binge. So instead of having a cigarette, they would have a chocolate bar or 2 chocolate bars or a packet of crisps and such. So we say change, but I'm not saying have a chocolate bar instead of a cigarette. That's not going to be good for you either. It's going to be unhealthy. But we could say, well, I know, instead of having a cigarette, I'm going to have a banana, you know, or some fruit or something like that. Yeah, or some, like a cereal bar or something like that, or a protein bar or something that will fill you up and not want you to pick. Yeah, but you could also swap, you know, cigarette for something else, you know, like something that you would want, like a boiled sweet, for example, or something like a Werther's Original or cherry drops and things like that. Pop one of those in instead. Chew on that or something. Yeah, that's a good idea. All right, but don't be a pig. That's easier said than done, but I mean, you're a good weight anyway, you know. You say you eat quite well, so try not to let that slip as well. All right, I want to keep that going. Yeah, good. So you want to change your routine, so your before and after meals, because at the moment you're in a routine of you have your dinner, then you have a cigarette, okay? But you want to stop that. You don't want to have your dinner and then think you need a cigarette. You're going to do something else. So think of another thing that you can do. So for example, after a meal, I'm going to walk the dog. Or after a meal, I'm going to read a book. Or do a bit of housework. See what I mean? So try and find things to do and sort of make that a routine if you wish. Instead of thinking I need to go and have a cigarette, is I'm going to have a cup of tea, for example. You get my point? All right. What I want you to do is try washing up after you've eaten. All right. Instead of going straight for a cigarette, how about just go in, fill up the sink, wash all the plates and things up. Your mind's distracted then. You're not focusing on I need a cigarette. All right, you're focusing on what you're doing, and then you're breaking the pattern, you're breaking the routine and making a new routine. Does that make sense? Good. So give that a go. Pop on some music even, you know, do a bit of dancing as you're washing up, you know, get a bit of exercise in. Yeah, sing, dance, whatever. Just be careful. All right, do something like that. That's what I recommend that you try. You try that for me. Okay, so try that. Said, what have you eaten? Even breakfast? Had some breakfast? Wash it up. Then go and do what you got to do. All right. And if you do smoke in the car, I advise you not to. It can be a distraction anyway, which is not really what you should be doing when you're driving. But if that's something you do, please refrain from that. You need to break that out. Okay, think I shouldn't be doing this anyway. Okay, good. And also, I want you to change your drinks. Now, I know you're thinking, oh, I've got to stop smoking, never mind anything else. But, I mean, especially at times when you would normally crave a cigarette, we want to have something different because certain drinks actually make cigarettes taste better. So, fizzy pop, alcohol, tea, coffee, things like that, okay? They make cigarettes taste better, all right? But we don't want them to taste better. Want to taste horrible, actually how they taste. So things like water would be good, all right, and possibly switch, you know, wine to a vodka or a tomato juice and stuff like that, if you know what I mean. Yes, think of something a bit different. All right, think you can give that a go? Good. I want you to identify your cravings, all right, at what time they come. What are you doing at that moment when you get the craving? What are you due to do? What have you just been doing? All right, write that down, because cravings can actually last 5 minutes before you actually give up. All right, does that make sense to you? Okay, so I want you to also write me a list of 5-minute strategies. So these are things that I want you to do. All right, so for example, if you're at a party, leave it a few minutes early, okay? And you can go and have a dance, go to the toilet, powder your nose or whatever, do something else, fill those gaps. But do it to suit you and what you're doing. All right, okay. So I want you to actually think about what it is that you're doing to your body physically, okay? For a moment, just sit there and actually think about the damages and things that it is doing to you. Just sit there for a moment. I mean, drinking and smoking, you know, raises mouth cancer by 38 times, which is a lot. And that's just mouth cancer, never mind the rest of the things. All right. Okay, a few more things here. So I want you to get some support from your family and friends and possibly support groups, all right? So speak out, tell people how you're feeling, explain to them what you're doing. You know, if you have a blip, talk about it. You know, don't feel ashamed, don't feel embarrassed about it. Own it, all right? Just, you know, okay, this has happened, deal with it, move on, all right? But I want you to also be proud of your achievements and your goals, you know, share your success, you know? Make a point of it. Yay, it's been a week and I haven't had a cigarette, you know? You might feel like, oh, really? But it's not. It's a huge achievement, all right? So we need to share the success. Talk to people about it, you know? Ask people for tips and talk and get distracted, you know? Even talk about the bad things of it and make that a point of, I'm not going to have one actually. Do you know what I mean? Good. So we can do that. I'll give you some information on some support groups that are local as well. Okay. So get moving. I mean, if you go to the gym anyway, that would be, you know, a good thing. But if you don't, which I don't think you do, right, that's right. So you could do 5-minute exercise. So you can do a walk, stretch, all right, anything like that. A little bit of marching on the spot or something, all right. And you want to cut out the cravings and help the brain produce anti-craving chemicals. So I think, oh, I need a cigarette, and you're like, no, march on the spot. 5 minutes straight, done, craving's gone, bam. See my point? Okay. Or we can pop on your favourite song and do some dancing, singing, you know, why not? Enjoy yourself, yeah? Okay, do something like that instead. Good. I'd probably try to limit how much time you spend with people that smoke, all right? Now, the why I say that is actually passive smoking can make you crave it. So you think, well, I'm not actually doing anything. I'm not smoking, I'm doing fine. But you're in that moment where they're having a cigarette. It's actually triggering off your cravings. So you're sitting thinking, oh, I really could do one of them. I want one of them. And then your mind's too focused on the cigarette and the need. All right. Does that make sense? So maybe just to start with, maybe just try to be around those people who smoke a little bit less, or ask them if they could smoke out of the room or such and such. Does that make sense to you? Yeah? All right. I don't want you to isolate yourself, though. That's not a good thing. I mean, some people say, well, make new friends, but it's not really that easy, is it? And I wouldn't say losing your friends over something like that. All right. Okay. Good. Now, the one thing that is really, really important is keeping your hands and mouth busy. Okay? Because some people find it a habit of going like this. So it's constant, that kind of motion. Now, maybe just get a pen and do that. You know what I mean? That's why some people have vapes, because, you know, they can keep themselves busy. But things like a fidget spinner, you know, some poppets or something like that. Or some bubble wrap or things like that. I'll go and get you something in a moment and I'll show you what I mean. I've got an example of things. All right. So we can give you Nicorette replacements. Okay, so we've got gum, patches, tablets, lozenges, nasal spray. We've got handheld e-cigs, but again, those can all become addictive, so we have to limit how much we are using them, because people are like just replacing that with that rather than actually using it to help wean off, if that makes sense. Yes, we need to do something like that. Anything like that that you think you would like to try? Okay, so possibly we could do some gum then, and some patches to start with. All right. The patches tell you step by step where you should be at what stage. All right. The gum's quite good, so, you know, when I said, you know, do something else, and, you know, pick a ball sweet, for example, you know, you could always put a gum in if you need to. But eventually I want that to go and just say be a cherry drop, for example. Does that make sense? Okay, good. Right, I want you to do another thing for me. I want you to write a list of things why you want to quit. you've briefly told me already, but I want you to write the list. Bullet point them, number them. Things where you want to quit: my health, my family, blah, 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 blah. Okay? Do that for me. Okay? So, give me 5 things why you want to quit. Yep. Okay, good. Yep. Okay, what else? Yeah, brilliant. Good starting point. If you think of any more, you can add to them. All right, good. You could also try relaxation classes in person, or you could do a bit of meditation. You could pop on some YouTube and listen to meditation or ASMR, things like that, as a distraction. Okay, they can help you sleep, relax, and some of them are like escapism, you know, like some people, ASMR can be like a movie, you know, some of the stuff is that good. I would definitely recommend that you check out some ASMR channels on YouTube. All right, there's a fantastic amount of artists, and they do a range of different things that are visually stimulating, or, you know, audio, things like that. All right, but have a Google about it. All right, I've got a leaflet about ASMR actually. I'll give you one of those as well. You could try hypnotherapy, CBT, things like that, if all else fails. Yeah. Okay, so let me just give you. So you want ASMR information. You want your booklet. Okay. So that's that one. There you go. Take those. Thank you. You'll be fine. Honestly, you've got this. All right? Yeah. Just be positive about it. It's a journey. Okay, you can do this. All right? I assure you, you are strong. You're stronger than you think. All right? Just got to get that oomph, that willpower, the motivation. You know, you've got to work towards something. Maybe make something an achievement. So I don't know, say if you go 3 months without having, say, a cigarette, you know, buy yourself something, go somewhere, then do another 3 months or something. Give yourself you know, a reward of when you've done something good. Does that make sense? Okay, stuff like that. All right, but I'll give you another information leaflet actually about things I have discussed with you today. Okay, you take those. Okay, so make sure you read through those for me. All right. Let me write this prescription. Chemist will go through these with you. All right. You. Thank you. Please try and get that today. That'd be really good. Right, so do you have any questions for me? I know I've bombarded you with all sorts of information. You're probably a little bit, whoa. All right, well, that's fine. If you have any questions at all, please just don't hesitate to call me. All right, and we can have a chat. But I want to book to see you again. I want to review in 2 weeks. Yeah. So, prescribed Excellent. So I will be writing everything up as soon as you've gone. So all the checks will be going on to your file. All right, and I will be rounding everything up and writing a little report up. All right, so that'll be all in there, so don't worry about that. But if I can just book you in a follow-up, please. 2 weeks' time. I can do same day and time, and that'll be 1, 2. What do you think? Okay, I'll book that in for you. Excellent. Do you mind if I send you a text with that? Okay, just confirm your number. Great, you should get that anytime now. Perfect. It's good. Fantastic. So, we are now complete. So, this is a massive step, and I'm really proud of you. Okay, you can do this. Just think that you can do anything you set your mind to. All right, anything. You can do anything you set your mind to. Okay, think about this. Do anything you set your mind to. All right, you've got the strength, the power to do that. All right, you've got this. All right, little steps, baby steps. Okay, you've done your checks, everything looks great. All right, need to pop to the dentist and just make sure all that's okay. All right, just make sure you are up to date with your eye examinations. And I would say that you need to have some routine bloods, all right? But I could check everything out and I can do that for you on the follow-up, all right? Okay, but, you know, work through that booklet, write everything down, you know, your goals, your promises and your achievements and any blips and things like that. All right, use that book, it's very, very useful. Okay, keep that with you, it's like your little, you know, pride and joy. Okay, all right. And remember everything we've discussed and things like that. And if you have any problems, whenever, please don't hesitate to, you know, just contact me and we can have a chat. All right, if you need a bit of encouragement or a bit of a boost. But like I say, look at those artists on there, the ASMR artists, they'll really help you. All right, help you focus and chill out and things like that. It's brilliant, it really is. All right. You're very, very welcome, my lovely. So do you feel all right? Feel promising and uplifting and motivated? Good. That's what I like to hear. All right, so you've got no concerns or anything like that? Okay, good. Sure? Perfect. That's fine. So you go and get all those things booked in to be checked out, your gums and your teeth and things like that. All right, you've got this, it's fine, don't worry about it. I'm sure it's nothing too bad, so don't worry, okay? Yeah, I know, I mean, even if it is the onset of gum disease, it's fine, they can treat it and it should reverse itself, so don't worry about that. All right, don't start worrying over things, okay? All right, that's fine. Okay then, my lovely. Well, I will let you go and good luck. You can do this, stay positive, all right? And I'll see you in a couple of weeks. You're welcome. You take care now. Bye-bye.